So I'm going to let our special guests introduce themselves.
Hi everyone, my name is Emily. I'm one of the PAs here. I'll be introducing this exciting specimen to you guys this morning. Okay, and then I think that leads us to our first question.
What organ/specimen is this? Interesting spread. And we'll end there and we'll share the results. So yeah, I think for the most part, people got the right one there. It's something near and dear to me and my practice specifically. And these are lymph nodes.
So these here are lymph nodes. As we can see, they come in a variety of shapes and sizes. You can have some that are round, some that are more elongated, some that are kind of barbell in shape. So they're a secondary lymphoid organ, typically composed of an inner medulla and outer cortex. From you guys that look at these histologically, you'll notice that they usually have a fibrous capsule, which will extend into the lymph node to form multiple trabecula. So the main functions of our lymph nodes are to filter lymph. And in pathology, these are very important to assess for things such as metastasis and to kind of determine if there's chronic inflammation or acute inflammation going on. So typically in the pathology lab, we'll receive these lymph nodes commonly in neck dissections. We also receive them as, sentinel nodes are also very important, which we receive on breast, melanoma, and gynae cancer specimens. Another type of important function of the lymph node is to determine whether there is lymphoma. So these lymph nodes here, you can see that they're actually kind of very firm and brown. So these have been placed in fixative, but when we're assessing a lymph node for lymphoma, we need to receive them fresh to do our lymphoma protocol here. So I'm just going to show you guys how our institution treats lymph nodes that are submitted for a lymphoma protocol.
So before we get to the lymphoma protocol, I just want to put one poll question up just to introduce the idea to people of what is a lymphoma protocol. For this question, which one is not a common component of a lymphoma protocol? Okay, so this is an interesting spread. Can someone in the chat tell me what's the main purpose of a lymphoma protocol before we address the answer here? That's right. So to save tissue while it's fresh for different studies, right? Because once you process the tissue, there's no turning back. So really fresh tissue is what you have in front of you. And you better have a way of triage. So the lymphoma protocol is a way of triaging the tissue while it's fresh before you submit it for any preparation or any manipulation at all. The answer for this one is mass spec. Believe it or not, in the old days, electron microscopy, when it was still quite common, remember you need to prepare tissue for EM in a different way, right? Whereas for mass spec, you can either get it frozen, but nowadays mass spec, you can actually get it from fresh, from formalin fixed tissue. So touch prep is something that you need to do while fresh. Obviously frozen tissue while fresh. Once you go into formalin, you can't come back. Flow cytometry requires fresh tissue. EM would require fresh tissue, but preserved in something else. Can someone in the chat tell me what that special prep for EM might be? Thank you so much. And we talked about mass spec. So yeah. So with those, then we'll briefly talk about the lymphoma protocol as it applies to lymph nodes.
Okay, going back to lymphoma protocols. So to assess a lymph node for lymphoma, we need the lymph node received fresh within the lab. These ones are fixed, but I'll show you kind of the gist of it on this. So once received in the lab, we'll measure the lymph node in 3 dimensions. And then the next step is to serially section the lymph node.
So again, folks, just want to iterate that it's this is unfortunately fixed already, but pretend that we're processing a fresh tissue.
Okay, and so once serially sectioned, typically lymph nodes fresh, they look a little bit more pink, more red. You want to assess and see if there are any areas of the lymph node that appear more pink and fleshy, because these are the kind of the hallmarks of what lymphoma would look like. So I'm just going to put down a bottle here. So this is our RPMI. And this is the media that we use to transport the lymph nodes to the lab for flow cytometry. So typically what we do, if the lymph node is big enough to serially section, all we need is one of the cross sections to place into the RPMI. And here I have a kind of cylindrical container containing some of that. We place that in there and we'll label it with the patient's ID, and then that will go to the flow lab and be assessed for lymphoma.
If it cannot get transported right off the bat, it can go in the fridge for later transport.
All right, I guess we'll move on to...
If you can just demonstrate a touch prep for people.
All right, and then we'll demonstrate a touch prep. So we have our slide here. And so typically with the touch prep, you want to also select one of these cross sections and basically touch it to the slide twice. You don't want to smear or smash it on, as that will kind of give you a thicker layer of cells. Once you've lightly tapped the cross section of the lymph node to the slide, you want to put it into some touch prep fixative. So this fixative is usually composed of a mixture of absolute ethanol and formaldehyde. You could also use a cytofix spray or just, I guess, absolute ethanol as well.
Yeah. So yeah, just want to reiterate here, the touch prep, I believe it's a very important part of the lymphoma protocol, not so much for lymphoma, but it's particularly useful for carcinomas. So if carcinoma is part of differential, touch prep is really useful in picking up the glandular type of arrangement, and not so much for lymphoma per se. So you can save a lot of money by doing a quick touch prep and saying that this is a carcinoma and not having to go through the entire protocol. So the other components of the lymphoma protocol is frozen. So that's pretty straightforward. Either you have either a liquid nitrogen tank nearby that you can just plop these things in, or dry ice. You put it in a little Eppendorf container, plop it into dry ice or liquid nitrogen, and you're good to go as a frozen section. Formalin's pretty straightforward. You just put it in a cassette and into formalin, and that's about it. So that's your lymphoma protocol. If you ever get a chance to be called down for it, that's how most labs, I would imagine, would do it. Certainly our preferred way here and my preferred way. And with all that, you should be able to evaluate lymphomas. And I think that's it for specimen number 1. Is there any questions? Oh, there's a question. Do you cover slip the touch prep? Generally, no. You can if you want to. I prefer to, but you don't have to. Any other fixative for lymph nodes? We talked about Bowens before. Bowens is actually pretty good for lymph nodes, but it's fallen out of favor because the way that Bowens interferes with immunohistochemistry, and it's very, very poor. You have to validate your own set of immunohistochemistries if it's something is Bowens fixed. And as you know, lymphoma pathology is an exercise in immunohistochemistry as well. Excellent questions. Thank you.